Welcome back to Midweek Politics. Lot to talk about. Brad Blakeman, who is a conservative guy you may not have heard of, there's still fake debate going on TV regarding Iraq. It's amazing. He was on MSNBC, and he started bringing up, I thought we were well past this, Lewis. We freed 50 million people in Iraq. Take a listen.
I agree with Brad that any president could have given this speech, although I have to say, I'm sorry, but if President Bush would have given this speech, I think we would have heard a lot more bumper sticker sloganeering than we heard. Again, I think President Obama was very eloquent. I think it was a very sobering speech. It was not cowboy diplomacy by any means.
But we weren't cowboy diplomats, Karen. On quite the contrary. If you look at the rhetoric of George W. Bush, it was very consistent with Bush's policy, and we freed 50 million people from Iraq. Now it seems that our president is on board and is basically following the same policies as the Bush administration.
Okay, so another non-reality-based fake debate on MSNBC with both sides with ridiculous just talking points. I mean, we're what is it? 6 years in, almost more than 6 years in at this point in Iraq. We freed 50 million people. That's the argument we're having now. I don't get it. It's unbelievable to me. Healthcare. Remember last week we talked about, okay, the public option is gone, but there's a Medicare buy-in. If you're 55 to 64, you can buy into Medicare. It won't be cheap, but you can do it. Here's what Barack Obama said about it.
This plan will strengthen Medicare and extend the life of that program. And because it gets rid of the waste and inefficiencies in our healthcare system, this will be the largest deficit reduction plan in over a decade. Okay,
the Medicare buy-in is basically removed. So now we no longer have that either. It's incredible, Lewis. Every single week when we think this healthcare reform plan can't get even more watered down, it does. I mean, now we've essentially removed the one thing in it, well, not one thing, but a major thing in it that was looking like it could be some kind of good option. It's amazing.
I don't even know what's in it now.
I don't know what's in it. Well, I have the list here, but and we'll get to it. There's a few other things in here. You can charge people. There's a big hubbub about we've removed denial for pre-existing conditions. Well, you can still charge people 3 times as much as the base rate based on age. Now, who is most likely to have pre-existing conditions? Well, of course, there's no rule. People can have pre-existing conditions at any age, but the older you get, obviously, the more likely that is. Remember Joe Lieberman? There's talk now about this is his bill. This is the Joe Lieberman who is saying he may filibuster the public option, one of the main detractors and obstacles to any kind of reform. What does he think needs to happen? Take a listen.
I want to tell you, we could pass a health care reform bill this week with more than 60 votes, and it will be bipartisan if we just took a few things out of the bill as it is today.
We have just a short time. Give me the list of things that have to be taken out to pass.
Well, from my point of view, no public option, no Medicare buy-in, Class Act, which will add to our debt in the future. It doesn't take much more than that.
And let's just take out all the reform, and then we'll have a great bill that Joe Lieberman can support. That's what he's saying, is it not? Am I wrong, Lewis?
Pretty much. That would leave a couple things.
Let's take out the main components of the reform, and then it'll take a week. All we need to do to pass reform is to put in a bill that doesn't change anything. That's all we need. What's still in the bill? That's a good question, Lewis, and I'm glad you asked it. And I have it here. Number 1, it will require insurers to offer a minimum amount of coverage to nearly everyone. Nearly everyone. Okay, that's good. It will bar insurers from denying coverage because of pre-existing conditions, but you can charge much, much more based on age. And then there's this obesity clause we talked about, which I don't know if it will be in the final bill, but it would say obesity is the one thing that can allow you to deny people coverage. And by the way, what conditions can obesity be connected with? Heart disease, diabetes, so on and so forth. Essentially, pre-existing conditions. There may be a waiver where if you're obese as a result of those, you can still get covered. Very, very muddled. Extremely muddled. Low-income people would get government help to buy insurance. And this could apply to families of 4 earning up to $88,000. Okay, that sounds all right. Medicare costs would be trimmed. Just that one talking point doesn't tell us anything about how it will be done or what exactly will be done. Some, including Democrat Ben Nelson, want stricter limits on abortion coverage, i.e. make it as difficult as possible to get an abortion covered. which, as we've talked about, will not reduce the number of abortions. It will simply reduce the number of safe abortions and increase the number of mothers who die either giving birth or involved in some kind of unsafe abortion. It will also require that people have health care. There will be about a $750 penalty per person after 2016. Disaster in Massachusetts with people choosing the penalty instead of insurance because it's just more economical. They still can't afford the insurance. It will also end separate rates due to gender differences, which is allowed in most states right now. Women who live longer, I believe, typically pay less for insurance. Although I don't know if in some states they pay more because they might get pregnant, and that represents a large insurance expenditure. This is not seeming like a very good bill to me.
It seems like something that would be of no financial or fiscal concern to the insurance companies. That's what it looks like at first glance. At first,
with the exception that they've gotten everything they wanted. So I'm sure they figured out the way that it'll make sense for them.
Right.
Joe Lieberman will try and take credit, of course, for the passing of a progressive healthcare reform bill, as he calls it. We don't need to hear Joe Lieberman talk about that. It's the same old thing. Dana Bash interviewed Joe Lieberman on The Situation Room, and he basically said what we have now is a progressive healthcare bill. So I don't think we need to listen to Joe Lieberman to know that there's very little progressive left about this bill, is there not?
I mean, I guess, unless for some reason the bill changes again before it's passed. I don't know.
Howard Dean is now saying we need to kill the Senate bill. And you know what? I don't know that I disagree with him. I talked to Bill Scher before we went on the air today from liberaloasis.com and Campaign for America's Future. And he was saying, well, this would still save some lives. Anytime you can save lives, that's great. But I don't know. It just seems so marginal if there is any benefit to this, especially from where it started. Let's take a listen to Howard Dean.
Governor Dean, you have been on this cause of health care reform for decades. There has been no more energetic cheerleader for this legislative crusade this time around than you. You have reached the point now where the Senate bill, which is well on its way to becoming the Lieberman bill, is something you can no longer support and you want to kill it. Tell us why.
Well, I'm not going to give up on health care reform. I'm still hopeful that something will happen in the House, but it's not very likely because the conference committee could be vetoed by Joe and the other pro-insurance company Democrats when it comes back as well. So real reform in the House is a lot less likely given what's happened in the Senate. This is not real reform. It's not health care reform. There are no choices. What the decision has been made without really thinking about it. It's been made because people are exhausted and they want to pass a bill so desperately they're not thinking about what they're doing here. It's been made to commit the United States to health care reform through the...
Okay, so the long and short of it, Howard Dean doesn't like this bill at all, and he's saying it might just make sense for Democrats to try to kill the bill. Will it happen? I don't know. A couple other health-related things. Researchers announced that radiation from CT scans done in 2007 will cause 29,000 cancers and kill nearly 15,000 Americans. The CT scans, that is. That's troubling, is it not, Lewis?
I guess so. If it's true, it sounds, I don't know. I mean, that's a huge number.
It's certainly. Children covered by Medicaid are being given anti-psychotic medicines at a rate 4 times higher than children whose parents have private insurance. Now, this could be concerning on a couple of levels. On one sense, it could be some kind of discrimination or bias, where if someone is of low income and they are on Medicaid, doctors may be more likely to prescribe something for them that they wouldn't for someone with private insurance. On the other hand, it might just be an indicator that those children are in situations where they actually require these medications. We would need to look more into this to know exactly what the bottom of it is, but it's the research seems to say that Medicaid children are more likely to receive the drugs even for less severe conditions than their middle-class counterparts. And I don't think this is a surprise. This is something we've known for a while. A lot of these children are very quickly just medicated with whatever it is, in this case, antipsychotics.
Right. I think we could get into a whole show discussion about overprescription or overprescribing drugs, you know.
Absolutely.